Every 70 seconds, someone develops Alzheimer's, and many of those patients and their caregivers may come to their community pharmacies seeking medication or other information. Community-based pharmacists have the unique advantage of an ongoing relationship with the patient and the ability to be in the position to identify possible early signs of dementia. Early identification and treatment of dementia is essential in preserving cognitive function, thus enhancing quality of life of older individuals. This lesson will equip the community-based pharmacist with the tools to recognize early signs of dementia, as well as the tools to identify medication that can worsen cognition and recommend cognitive enhancing medications and monitor patients towards successful outcomes.
Morning, ma'am.
Yes, good morning.
I'm the assistant of Mr. Richard and I would like to ask about the schedule of his counseling session.
Yes, is he available tomorrow at 8 a.m.?
Yes, ma'am, he's available.
Is it okay to set schedule?
Okay, then we will be there at exactly 8 a.m.
Okay, see you tomorrow.
Thank you, ma'am. It's a pleasure.
Oh, good morning, Mr. Richard. Good morning, Miss Perena.
Good morning, ma'am.
So, Mr. Richard, how are you feeling today?
Good morning, Miss Ampani. I'm good.
So, have a seat.
Thank you, ma'am.
I've seen your previous records and reviewed it. I see you have taken chlorpromazine and ferrosulfate. How is it working to you, Mr. Richard?
Actually, ma'am, I've noticed that my patient is a doctor. Is it normal?
Yes, it's normal. It's one of the side effects of the ferrosulfate that has been taken. Are there any complications aside from that?
No, Miss Ampani.
Okay then, so after a month, you came back to your physician and he gave you ranitidine for your constipation and abdominal pain. And also Jocosate with Senna for you to have a regular and smooth bowel movement. Have you experienced any complications when taking these medications?
No.
Okay. I've seen also that you have taken naproxen to reduce your joint pains and from your hypertension, as well as hydrochlorothiazide as your maintenance. Have the patient taken this medication together?
No, ma'am.
Well, sounds good because taking this medication will increase the patient's blood pressure. Have the patient missed any of this medication?
No, ma'am. Actually, my patient takes his medication regularly.
Okay then, that's good. And according to your laboratory results, Mr. Richard, your potassium is normal, as well as your blood sugar. Therefore, there is no adverse effect from your medication.
Recently, my patient had encountered some behavioral disturbances, like he acts like a child, easily forget things, mood swings, and sometimes he can't easily communicate with other people. So we went to the physician and he gave us his medication.
Okay, so he gave you risperidone and paracetamol.
Yes, ma'am.
For this medication, risperidone is intended as a maintenance for his short-term treatment for the patient's Alzheimer's disease. This should be taken 1 tablet daily, good for 60 days. He might encounter headache and fatigue because of this medication. That's why the physician has given the paracetamol to reduce this condition. Avoid or limit the use of alcohol while being treated with the medication because it can decrease the effect of the medication. So, Ms. Perenia, have you taken notes?
Yes, ma'am. 1 tablet, good for 60 days. Then, limit or avoid alcohol. Then, paracetamol is taken to reduce the effect of the risperidone. That will be all, ma'am.
Okay. So, aside from your medication, Mr. Richard, here are my recommendations for the betterment of your condition. Exercise is one of the best stress relievers. Simple activities can be a way for the patient to reconnect with their earlier life. Remembering the past, use calming music. Interactive regarding your medication, Mr. Richard?
No, no, ma'am. Thank you for the information you gave.
Excuse
Okay.
me, ma'am, for clarification of the recommendation, regular exercise, simple activities, remembering the past, use calm music, interacting with other people because it is still important, and pets can provide source of positive nonverbal communication. Is that all right, ma'am?
Yes. Very good. My contact number for the any clarifications.
Thank you, ma'am. And it's a pleasure. Thank you for your counseling.
Welcome. Thank you.
Illness such as Alzheimer's disease, the pharmacist can be a valuable resource to patients and families by detecting early signs of dementia and recommending appropriate medication therapies. Throughout the course of this progressively declining illness, there are multiple opportunities for pharmacists to assist patients in getting the most from their medication therapy. And when medications don't seem to be working, the pharmacist can be a source of information and support to families who need to make difficult decisions.